Hello, I'm Nancy Foldvary-Schaefer. I'm a professor of neurology at Cleveland Clinic Learner College of Medicine, and I practice sleep medicine and epilepsy medicine. What is insomnia? Insomnia is both a symptom of many other problems as well as a disorder. So when we think of the disorder, the medical problem of having insomnia, it's a problem of having difficulty falling asleep, staying asleep, or waking up too early. And when we consider it a significant problem, it's usually chronic insomnia, which means that it's been persisting for at least 3 months. What causes insomnia? We believe the brain in people with insomnia is hyperactive at night. They tend to have hyperarousability. They wake up easily, they may be a little bit nervous at night, and a lot of cognitive processing happening. So we think a lot at night, ruminate, plan the next day. That's typically the presenting complaint of people with insomnia. Other precipitants could be very simple things like drinking alcohol at night. It's very disruptive to deep stages of sleep, and it leads to awakenings and arousals during night, as does caffeine, exercising too late in the day, and taking medications that might be alerting, even like thyroid hormone replacement. People with asthma tend to sleep poorly. They tend to cough a lot at night. People with reflux, gastroesophageal reflux disease, tend to have heartburn at night, or they may just wake up because they're having some reflux. And then people with cardiovascular diseases and many neurological diseases like Parkinsonism, epilepsy, these are groups of people who tend to report insomnia and are dissatisfied with their sleep. What does insomnia feel like? By definition, the chronic insomniac has daytime dysfunction from not sleeping well at night. And this can range from just feeling tired or fatigued or even sleepy to interpersonal conflicts. We get irritable when we don't sleep. It can even lead to excessive use of over-the-counter sleep medications or alcohol. People with insomnia tend to not do that well cognitively during the day, so they may complain of memory problems or inattention, and they may have car accidents and have other kinds of problems because their motor reactions are not as sharp as they should be. How can you fall asleep with insomnia? Setting up the bedroom to be optimal for sleep is really important, but it's also important that we avoid certain daytime activities like caffeine after noontime, like alcohol close to bedtime, like eating heavy meals or spicy food at night, which can lead to stomach indigestion at night. All of those things are important to consider for initial treatment of insomnia. The most effective therapy is something called cognitive behavioral therapy for insomnia, which is a form of psychotherapy, so to speak, and it's done with psychologists who are specially trained and certified in treating people with insomnia. And they do a series of behavioral and cognitive kinds of exercises with patients, which is a longer term therapy. It's not as simple as taking a medication at night, but it's much more effective in the long haul. People who are really open-minded and very interested in working at treating their insomnia almost always improve with some form of cognitive behavioral therapy. And it really depends on what form of the therapy works well for them. I've seen patients who simply change the timing of their caffeine ingestion and reduce alcohol, who within a week are already recognizing that they're sleeping better.